Alexander Tin is with me now. He is a CBS News reporter covering COVID-19. Hi there, Alex. Are we seeing an increase in vaccination rates across the U.S. following the full approval of the Pfizer vaccine?
Well, that's a good question. We had heard for weeks and months now, not just federal health officials, but local health officials and public health experts all say that they hoped that full approval of Pfizer's COVID-19 vaccine would result in a boost to vaccination rates. And of course, over the past few days, I think today marks the 12th day straight of falling first doses around the country, we know that the nationwide vaccination effort, not just in specific states, but all across the country, has been slowing down. Now, the details of that slowdown are interesting. Number one is we know that states and jurisdictions and hospitals take a few days to report backlog doses. If they give me a first dose a few days ago, it can take them 2 to 3 days just to report that dose to the CDC. And so the latest figures that we have showing kind of the average pace of new vaccinations, the average pace of people who have been persuaded or convinced or otherwise cajoled into getting their first dose of a COVID-19 vaccine has been falling for 12 straight days. But that 12th day is actually from last week. It's Saturday of last week. So we still won't know whether the full approval bounce, you might call it, will occur for another 2 to 3 days. That's when that reporting average is going to catch up to what we think was the day of the full approval and potentially seeing whether there was a burst of interest of people looking to get the shots. Now, with that said, again, going back to those public health officials, going back to what we've heard from public health experts, yes, there was some people they hoped would be potentially persuaded by full approval, but the bigger driver and the bigger factor that everyone is hoping is going to increase vaccinations will come from employers and schools and other institutions that were waiting for full approval in order to give them cover, in order to, mandate or require vaccinations at their locations. Those policies are going to take some time to implement, but the real hope is that once those policies are implemented, we're going to see a real wave in new people getting their first shots.
All right, Alex, and very quickly, what is the latest on the journey to full approval for the Moderna and Johnson & Johnson vaccines?
Well, you'll recall that the Pfizer COVID-19 vaccine, or Comirnaty as we're now calling it, the reason it got full approval first was because they were the first to finish their submission for full approval to the Food and Drug Administration, or the FDA. And, that happened back in May. Moderna said this week that they have finally finished their application, their submission of data and information to the FDA for their full approval. We don't know exactly how long that's going to take, but let's assume that it takes roughly the same amount of time that Pfizer's COVID-19 vaccine took to get full approval. That puts Moderna's full approval probably somewhere in the November to December range of this year. In addition, Johnson & Johnson has said since it first got emergency use authorization many months ago now that it had planned to also seek full approval to file its so-called BLA, or Biologics License Application, by the end of this year. A spokesperson for the company really recently confirmed for us that they are too also planning on still completing that or filing that submission for full approval this year, potentially in the coming weeks. One thing that we think is potentially influencing their decision and their data on how they're going to pursue their application for full approval is we know that there's a trial going on right now by Johnson & Johnson that looked at giving recipients of their vaccine essentially a second dose roughly 2 months after their first dose. They're probably waiting for some data or from signs on that will affect how they essentially pursue full approval from the FDA. But long story short, we expect Moderna's full approval probably sometime later this year, if not early next year, and Johnson & Johnson soon after that.
And Alex, the CDC and the FDA are urging people to stop using N95 masks made by Shanghai Dasheng. What more can you tell us about that?
Well, last week, a division within the CDC called NIOSH, and that's the governmental organization that really regulates all of those N95 masks that you see being donned by everyone from healthcare workers to construction workers, right? And what they essentially are responsible for doing is making sure that every company that has that N95, designation or specification that is so hard for some mask manufacturers to get are meeting certain specifications for quality control around the manufacturing of those masks, not just can it filter a certain amount of particulate matter through the front of the mask, but also how does it fit and how regularly does it fit in that certain way and how does it fit on the head in that certain way. All of those specifications are something that is carefully followed by a lot of these mask manufacturers, both here in the United States and abroad, as they try to hew to these N95 mask regulations. What was announced last week was CDC's NIOSH essentially revoked all N95 specifications that were given to this mask manufacturer, saying that they had serious concerns about the ability of this mask manufacturer to ensure essentially that every so-called N95 mask they were making was truly meeting those specifications. The Food and Drug Administration this week followed up with a letter to healthcare providers saying if you are using masks from this mask manufacturer, you should stop using these masks. We know that there has been a major concern both among U.S. healthcare providers and other providers in both the healthcare industry and other industries about counterfeit masks. And it looks like this potentially may be part of a crackdown that the Biden administration has been promising for a long time into not just looking into counterfeit masks, but potentially masks that just aren't meeting those quality specifications, protecting healthcare workers.
Really important information. Alexander Tin for us. Alex, thank you.
Thank you.